I'm Carol Marshall. I was until quite recently the CEO of the Office of Health Standards Compliance. I've just retired. And I was asked to talk fundamentally about the National Core Standards, which have been a policy document since 2011 and have recently been reviewed and rewritten to some extent and then published as draft regulations, which are currently in the process of public comment and review and before submission to the Minister. So I spoke a little bit about the difference between issuing a policy guideline and converting this into the law, basically giving effect to the National Health Amendment Act, which was signed by the President in 2013, and that sets up the Office of Health Standards Compliance as an inspectorate. So I spoke about why one needs regulation and why it's important to use, in some instances, the power of the state or the power of authority to bring about a change in behaviour, and how the National Core Standards are intended to make healthcare safer, to make it more reliable so that patients get better care and so that outcomes improve, but also very much to focus on what makes healthcare more acceptable and more responsive to the needs of patients. Reflecting some of the inputs from the Minister in the morning, speaking about national health insurance as being universal access to quality care and the contribution that the Office would make towards establishing the basis for this. And then lastly, I spoke about some of the challenges about measuring whether institutions are actually compliant with the standards, how measurement tools are set up and how measurement processes happen, and some of the risks to those processes of perhaps not identifying when there are problems in an institution or measuring things wrongly or inconsistently or inadvertently driving rigidity and driving the wrong behaviour rather than the right behaviour. And then I ended up by talking about how a regulatory practice in accordance with the law will only have the kind of intended impact on the quality of the system if there is actually voluntary compliance. So it's absolutely essential that once an establishment has been inspected and found to be wanting, that something is done to correct those problems, and that even before that, it's never going to be possible to inspect every single institution across the country, nor desirable. And that what is most important is that hospitals and clinics need to make sure that they're providing good quality care and that they're implementing the standards. And that it's only as a very last resort that the actual punitive powers of the Office should ever be used. That it's not the intent of the Office to close down facilities or to punish people. It's the intent to improve the level of safety and the control systems in our hospitals and our clinics, so that collectively the whole system becomes one that is more compliant with basic protocols and basic risk management systems.